Our second question is from a listener named Rick, and he asks, I've been struggling with what feels like plantar fasciitis, but I haven't gone to a doctor to get it looked at or anything like that. Do you have any recommendations on what to do?
So plantar fasciitis, that one, it comes around a lot in the summer. And a lot of
Okay.
people will say that that's due to footwear because people tend to be more in sandals and flip flops and things like that. And there's no correlation to
Okay.
that. So it's not footwear. And I think we talked about
Debunk
footwear
that.
on a previous podcast. So it's not footwear. A lot of people will say that it's due to the plantar fascia itself. And the plantar fascia, for reference, it helps to make this arch in the foot. It's a very robust fascial tissue. Our arch is meant to be pretty springy, so that when it hits the ground, it is transferring force to the ground, and then it's returning that energy, getting force from the ground, and then returning that up to the body. It's a continuation of the Achilles, the triceps surae, all these muscles that come together along the bottom of the foot that make this whole fascial network. It's a very dense tissue. The fascial tissue in itself, it can have micro tears in it. When these micro tears accumulate, that's when it starts to become sore. What we've found is that if somebody has this, one of the best things that we can do is a nerve glide.
Wow.
So, what is a nerve glide? If you imagine like a muscle, for example, if you want to stretch your bicep, you would go into shoulder extension and elbow extension because now you're lengthening the bicep through both of the joints that it crosses. Yes, the biceps crosses the shoulder. A lot of people think it's just the elbow, but it crosses the shoulder and the elbow. Nerves don't stretch, they slide. So if you imagine like a piece of floss, if you have plaque in your teeth, you put that floss between your teeth, you go back and forth as the floss goes back and forth, and now hits the plaque out of the teeth. So when you're doing a nerve glide, it's the same thing that's happening. You're taking that nerve sheath, you're moving it one way, and then moving it back the other way. So what nerve glide do you use for that area of the foot? Well, that area of the foot is actually a continuation of the sciatic nerve. We hear sciatica all the time,
Hmm.
but people assume that that's just the back of the thigh and the low back. The sciatic nerve, as it travels from the low back, goes down the back of the thigh, it branches off into the tibial nerve. The tibial nerve goes down, the bottom of the foot becomes the medial and lateral plantar nerves. These nerves, they tend to get irritated from either it's an increased workload of walking. That's another thing that we see in the summer. People are up and moving more. So it
Hmm.
tends to be a workload thing of how many steps have you taken the past 3 months versus how many steps did you take in the winter. And being
Hmm.
in upstate New York, a lot less steps are taken in the winter than they are in the summer.
Right.
And if you're wondering, well, what's my step count? You don't have a step counter on your watch, but you have your phone with you on walks, open up the health app on your phone. It's been tracking your steps this whole time.
Hmm.
So you can get these nice little graphs of steps. So it's workload, but then back to the nerve glide, you want to glide the sciatic nerve because it's actually going to mobilize the medial and lateral plantar nerves, which is then going to help that fascial tissue and the nerves just move a little bit more freely and quote unquote clean the plaques out of there.
Wow, that's fascinating. And so it's you don't necessarily have to go get like a plantar fasciitis brace or wear sneakers for the rest of the summer or whatever. It really is the simple nerve glide.
Simple nerve glide. And if you're wondering, well, how does this work? Like this nerve glide idea. Well, what's the traditional treatment for plantar fasciitis? Get a lacrosse ball or freeze a water bottle and roll that on the bottom of your foot.
Mm.
You are not breaking up fascial tissue with those things.
Hmm.
In order to change fascial tissue, you need a young bull to stand on the tissue for it to deform 1%.
Wow.
So a lacrosse ball and a frozen water bottle, they are not deforming your fascial tissue.
But maybe go get a cow.
But maybe go get a cow and have it step on your foot. No, then you'll be like my buddy after high school with the crutches
Right.
after the foot fracture. But these things are not changing fascial tissue. What they are doing is changing the input to the nervous system.
Okay.
You change that input to the nervous system, then the brain starts changing its output of the pain response to that area. The nerve glide's doing the same thing. But with the nerve glide, you're actually mobilizing the whole nerve through the entire leg and up through the back and the spine instead of just at the foot area. So if you want to use the lacrosse ball, you want to use the frozen water bottle, go for it. But know that you're not changing fascial tissue. You're just giving that nerve better input or more input, allowing it to make different choices.